So I completed my MPH program this past year before my first year of medical school, and I am really grateful to have had that opportunity, and I definitely think it's a great option for any students who would like to pursue that direction. One of the biggest benefits that I found was honestly the people involved. I met a lot of great students and future uh, classmates during the MPH program year. They are people I still do activities with, still study with. I knew coming in that they had similar values and thoughts about what they wanted out of the MD program, and it's been really, really helpful just having people that I know that I can count on if I need anything, and just made the whole entrance into medical school a lot less stressful, already having essentially a built-in group of friends. Going off of that, it's been a lot less stressful just knowing the HSLC, knowing Madison, being familiar with the faculty and how the school works. I feel that with all the changes going into medical school, having a little bit of familiarity has really been beneficial for me as well. The MPH really was a great transition year between undergrad and going into a graduate program. I found that I was able to take a lot of classes and get to know how the faculty approaches things, and also explore some of my interests before entering medical school, such as infectious diseases, epidemiology, and also some of my global health classes. So that's been a big advantage, having already completed most of my global health classes before even entering the medical school curriculum, so my certificate's almost complete. I really think that being a part of the MD-MPH program had let me approach medical school differently. I think that me and my other classmates truly look at things with a different perspective, looking at disparities and equities, the social determinants of health. It's been interesting to see patient care from that perspective. And I think that having that training has really helped open my eyes to some of the issues that patients face when entering into the medical field outside of just the disease or symptom that we're looking at. In addition, I've been able to look at some of the community health projects and continue working on my own that I started during the MPH year. And that's been great to have something that I'm passionate about and continue working on that through this year, and also becoming more comfortable just working in a community, working with community health, and really exploring advocacy and working with patients throughout this year. And I'll be starting Triumph next year in January. And I think having had this experience with the MPH fieldwork and capstone project already, I feel a lot more comfortable entering in and doing that community health project now. And knowing how to work with the community, how to work with some of those community organizations. So that's also been a huge benefit for me. And finally, I think that the MPH program really teaches a lot about advocacy and all of the things that we need to do beyond just treating patients in the clinic, and I have found that really helpful. So I highly recommend taking the MPH year before your MD year if you're sure you're interested in it, and feel free to reach out if you have any other questions.